Welcome to another episode of Ostomy and IBD Life. This is where we get to talk about all things from having an ostomy, having Crohn's, ulcerative colitis, even IBS, talking about the physical aspects, the mental and emotional things that come up for us, and we get to have some nice, honest discussions. My name is Elaine O'Rourke. I'm your host here every week. I have had my ostomy, my ileostomy for 15 years due to Crohn's disease. And I also work with people with ostomies through my programs and also people with Crohn's and colitis. So I do just want to say, if you are struggling, please reach out to me. You can send me a message. You can get on my mailing list. I have a couple of free guides underneath my ostomy program section and my IBD section on my website, which is elaineo'rourke.com, and that's toggling along the bottom of your screen right now. So this week, I am delighted to say that my sister Jeannine, who is a gastroenterology nurse, certified GI nurse, it will be my very, very, very special guest. Firstly, before I bring her on, I want to remind you that you can put up comments, whether you're tuning in on Facebook or through YouTube. So if you've got questions, if you have any comments, if you feel like sharing whether you have IBD or if you have an ostomy or where you are in the world, where you're tuning in from, then I love to hear from you, and we love to get questions as well. Also, if you are watching this on the replay, I do check in on the comments all of the time. So I try to answer any questions that come up after the live broadcast. So know that you can put your questions up there also. Let's see, what other business do I have to tell you about? I think that's it. Oh yeah, always, if you are on YouTube, please subscribe to my YouTube channel, which is Elaine O'Rourke Yoga, Ostomy, and IBD. Even if you're watching this on the Facebook page, if you ever have the opportunity to go over to my YouTube page, it's really helpful just to put in a like or to view the videos there. Ultimately, because it helps more people to find me and to find this great content that I am hopefully bringing to you. Another thing, and it may have worked itself out, is if you're watching this on Facebook Live, if you're watching it on my personal page, sometimes I don't see all the comments. So if you can go to my Ostomy and IBD Live page, and you can follow me there. And I know I definitely see the comments through on the stream from that. So enough about all of that business. And let's get down to our chat today. So as I said, my sister Jeannine is really up there on the most amazing people that I know, besides my mom, who is my other nurse, and my other sister. Gotta be careful here. But she has been my nurse. She also lives over here in the States now as well. Well, we've been here quite a few years. But she's been my nurse. She has been my caregiver. She has looked after me. She answers all of these medical questions that I have no idea about, and she explains so much to me, and I am forever indebted to her, because when I was super sick, I went and stayed with her because I couldn't even look after myself anymore. So I'm going to bring Jeannine right into the room. Hey, Jeannine.
Hi, Elaine. How are you?
I am awesome. We just had a slight little delay, but that's okay. Delighted, and thank you so much for coming on right after your work day. Jeannine, funny little story to start with. When I first came over here, I was temping, doing administrative work, and I got a temping job at the Brigham and Women's Hospital. And I always had an aversion to hospitals, mainly because in Ireland, where we grew up, the hospitals were not very up to date, and there was just like this disgusting smell, and they just turned my stomach. So I got this admin temp job at the Brigham and Women's Hospital in research. But the first day I started there, I couldn't pronounce the word. And I had to call my sister up and spell out this big long word, which was gastroenterology, GI. And then, of course, I ended up working there for a number of years, and that's where all my issues ended up being. And my sister, Jeannine, ended up working in gastroenterology. So thank you, Jeannine, for explaining to me how to pronounce the word. And then she told me, just say GI. I'm like, oh, that's so much easier. So Jeannine, we're here to talk about patient care is one of our topics this evening, and also you, as I had said in the intro, you are an endoscopy GI nurse, so you're going to be also talking to us about colonoscopies. Firstly, let's get into the patient care aspect. So you were my nurse, and I don't know what I would have done if I didn't have you going to appointments to me, because when I was sick, I mean, my brain, I couldn't retain any information. So can you kind of like walk us through from your perspective, and also as a nurse, how important you see that role?
I think it's always very important that you bring somebody with you, whether it's in GI, whether you're going to a doctor's appointment or anything. Having another pair of ears, it's amazing what one person can hear and what the other person can hear. So sometimes, especially when you're sick, you're almost in denial. I have patients come in and they really walk out of the room and they have no idea what has just happened and what's been told to them. And you can see that they're shocked. They shut down and they really don't. It's really important to have somebody there, somebody that's going to ask questions, advocate you, write things down, and never be afraid to speak up. Never be afraid to ask for other people's opinions. Sometimes people think that they hear something and that's it. Please speak up. We always want to help people, but having another pair of ears, I can't emphasize it enough. I remember going with two appointments, and I can't, it was so important. And I think that I learned as well, because as a nurse, it made me really realize it's also different when you're that close to somebody and how much you care about them. Sometimes you too can hear things differently. So, but being a nurse really helps, and having some medical knowledge really helps, or having somebody who knows the questions to ask is definitely a plus.
Absolutely. And I do remember one appointment going in to see my surgeon, Dr. Lisa Breen, who was so fabulous. And you were working that day, and like I was staying down with you, and you were like, are you okay going to this appointment by yourself? Because you're like, I can take time off and meet you over at the appointment. And I said to you, I'm like, no, it's fine. I know the questions I'm going to ask. And, I did like learn to write out the questions, but I wrote out the questions and I have no idea what the response was. And I remember you met me after the appointment and you're like, so what did she say about this? What did she say about that? And I looked at you with a blank face going like, I don't know. Oh my God, I don't know what she said. And luckily, you're working in GI. I used to work in GI, so you were able to actually, I think, call her up and say, can you let me know what happened at the appointment? So really important, even if you think that everything is working okay up here, there's a good chance that there's some brain fog going on, just because your body is in such distress when you are sick, and it's just overwhelming for the system, and it's overwhelming to hear what is being said. And especially if it's new information, like, okay, maybe if it's even a diagnosis of cancer or a diagnosis of Crohn's or colitis, or that you're getting an ostomy. I mean, that is really hard to hear. So having someone to go in, to hold your hand and to be on your team is of utmost importance if you have someone. Another thing that we were talking about just before we got on here was I remember after surgery and being in the hospital bed, as to if I didn't have Jeannine, if I didn't have my mom and my dad coming in and helping me out throughout the day, there just wasn't time for the nursing staff to help to do all of the little things. Would you say so as well, Jeannine?
So I do think it's very important to have somebody with you in the hospital. And Elaine, just reminiscing about when you were a patient, and the care with you and having mom and dad was fantastic. And just even as a reminder for people who of course have never gone through surgeries like this, one thing that comes to mind again as a nurse, you look at it differently than your sister in the bed. And I remember after your surgery how repulsed you were with your own body. You actually did not want to touch things. You wouldn't look at it. You would just say to me, you just deal with it. I can't deal with it. And I think it's really important when I've been to your shows and I hear people, it brings it all back to me. We talk about this, the things that you forget. Sometimes things that I have forgotten about it too, because there was so much that happened. But I do remember you going, there's no way I can ever touch that or have anything to do with it. And I think it's important in early stages for people to know it's very normal to feel this way. And I think that when I look at Elaine, and I say this all the time, a huge inspiration to me, because I never ever thought I would see you like you are today. You're one of the most vibrant, well people, energetic, inspirational, doing yoga, surfing, traveling. I can't say enough about looking at this 80-pound girl that I honestly thought at one stage could die on me, and to see where she is today, leaving us all, and honestly putting us all to shame with all that she does. So for all of you out there listening, look at her. She knows how to do it. And honestly, having somebody along with you, I'm glad I've been on this journey with her. I'm honored to see where she's gotten as a result of it all. But you do need people to be there with you. So just don't turn away help. Take it. Have somebody in the hospital, like Elaine said. Have somebody at your appointments. It's really important. You need support.
Definitely. And thank you for saying that. You nearly brought tears to my eyes. Something, and this just popped into my head, and I know everybody is different, but for me, when I was ill, and you remember this as well, Jeannine, I didn't want any visitors at all, because I could barely speak. I barely had any energy to move. And it just for I know some people it's really helpful to have people coming through and to chat. But if you're one of those people, if you're like me going like, I don't want any visitors, it's actually it was too exhausting for me. And even after, like, post surgery, when I got back to your house and where I was staying at your if Mary and Jack, if you're watching, when I was recovering at your apartment, it was just too much on my energy system to even think about having any visitors. So I think that's important to, from a patient point of view, to know that it's okay to say, listen, I can't take visitors today. Or if you're someone that thrives off of that, go, yes, open up the doors, let whoever in that is here to help. So Jeannine, let's get on to talking a little bit about colonoscopies. So with colonoscopies, what are some of the reasons that someone with, say, Crohn's or colitis should be getting a colonoscopy or having that sort of follow-up?
So there are many reasons that people with Crohn's, ulcerative colitis need to have colonoscopies. The first part of your diagnosis. So it is usually one of the most important things to actually see inside your colon and actually see what's going on. We all know how one can feel. We know how lab work can look. We can do scans. We see thickening. But honestly, we can read what it's like in and take biopsies, see where the inflammation is. It gives us a really good picture of what is going on in your colon, what kind of colitis you might have, how bad it is, and this also relates to how you're feeling. So there's the diagnostic part, and then after that, it's very important to follow up. There's many reasons after you've first been diagnosed to continue to have colonoscopies. For the amount of inflammation and the length of time the inflammation is in your colon, it does increase your chances of colon cancer. It's important to be followed by a gastroenterologist. I would highly recommend one of the IBD centers where everybody is specialized in it. We will make sure that you have your colonoscopies done at the appropriate time to screen for any cells that are changing, that start to turn into cancer cells. And as I said, this is important depending on the length of the inflammation. There's methods that we have to do that. Chromo endoscopy, where we spray the inside of the colon to actually look at those cells and target cells that we should be biopsying and taking. And so, as most people know, colonoscopy is for everybody over the age of 45 these days, is screening for colon cancer. But in IBD, one of the other reasons to have it that comes to mind for me would be when you're on treatment, is it working? So sometimes you feel better and we go inside and we go, you know what, you might be feeling better, but there's still a lot of inflammation. We're not quite there yet. We still have to work with it. And there's never a perfect answer. It's always, I always say to people with colitis, everybody is unique and different. And everybody's recipe, if you like, of how we figure it out is different and put it together. But to me, the vision of seeing and getting those biopsies and getting a really good look is so important. And having a good prep is very important. And we'll talk about that a little bit, but very important to have a good prep too.
Great. So to be able to see how the meds are working, because sometimes you might be feeling okay, but there is still inflammation in there. So I think that's a really, really valuable piece of information, because I know through the years of having Crohn's disease, I would probably just go in, I can't really remember, just to see like, okay, what is going on? Or if I was in a flare up, then like definitely going in and looking and checking things out. So my next follow-up question on that before we get to the prep is, so someone with an ostomy, probably more so a colostomy or an ileostomy, how are procedures done if you have an ostomy? Or why would someone with an ostomy be having a procedure?
So good question. For someone like you who had an ileostomy and never had any small bowel involvement, you've never needed to have another scope, thank God, since you have had your surgery. But for an ileostomy, they also still have small bowel involvement. We sometimes do need to go in and look and see what's going on. And yes, we can put the scope right through the ostomy. We still do sedate you for it. It's not painful. You'll be comfortable with the sedation that we give you. The other reason, if people have any colon left, so if you have part of your colon removed, part of it left, we still need to look at any part of that colon just for colon cancer. So as long as there is colon there, it needs to be screened on a regular basis. And again, if there's colon there, depending on what type of colitis you have, we need to be screening that colon too for whether you're still on medications, how your colitis is doing. But ultimately, we are also screening for cancer of the colon always as well.
Right. And also then, so cancer of the colon and cancer. So if people have their rectum still there, then it would be screening for that also.
Yes.
Yeah. Okay.
So even if there's only a small,
it's just the rectal stump there. Okay. So before we get on to the prep questions, I see there's plenty of comments. So I'm just going to pop over into the comments to just see if there's any questions. And we got lots of people watching. Hi, Francine. Hi, Justin, David, Anita. Hi, Linda, Runa. Great. Oh my goodness, Owen's even watching. Hey, Owen. Good point. Owen says, yes, a second set of ears is so important. If you're emotionally invested in the patient's lives, then you need a distance party to help you, which is so important, right? Because, and this is another little point that I wanted to make as well, is can be so much attention on the patient, but also the caregiver really needs to look after themselves, because it can be just as hard on the caregiver to be watching a loved one go through cancer, or going through getting an ostomy, or just being like on death's door. So having your own, support group around you as a caregiver is really important also. Kasaria, hopefully I'm pronouncing your name correctly, comment saying, my colonoscopy usually is the only clinical indication of my disease severity. I feel terrible, but my lab work doesn't usually show anything outside of the normal ranges. Yeah, so having your labs done, but also, as Jeannine was saying, the colonoscopies, the scope really gives that clearer picture of what is going on inside. From Justin saying, my last colonoscopy was December of 92. It saved my life, resulting in my ileostomy surgery shortly afterwards. Yes, so getting that screening done does save lives, also really important. Nancy, I'm just seeing your other comment here saying, I've had an ileostomy since 2004 from UC. I could do everything in the world till a year and a half ago. I'm constantly bloated. I've had many tests and everything came back negative. So my question is, what can I do to fix this problem? I don't have any suggestions in regards to that, nor can we medically advise you. So I would go back, ask your GI team even more questions. Jeannine, do you have an answer for that, or an idea?
So I think what I was saying in the beginning, it's very important being a part of a good GI team, preferably an IBD center, is you'll have resources there that you might not have with a general practitioner or somebody who does not specialize in this area. So there's a lot of other things to consider. It's a very broad question, but with the right people, you'll be guided in the right direction. So I highly would recommend, if your doctor's not finding answers, either seek another opinion or go to a specialized unit that deals with just IBD patients.
Yes, great. Thank you. Anna is saying, my last colonoscopy led to me being unable to move for a month as I have bad perianal disease. I now fear them. I'm just going to bring this here. I now fear them, but still have to get on with them. And actually, that's something we're going to talk about. So we'll come back to that Anna. I'm first of all going to have Jeannine just talk us through a little bit about prep for colonoscopy.
So there are many different types of preparations. As I said previously, you do want to make sure your prep works, and it's a little bit of a myth. Some people think because they have a colitis, and for a lot of people with colitis, they have a lot of frequent loose bowel movements. For other people, they can have alternating with constipation. But in general, the most important thing is having a good prep. So finding something that works for you, you're going to have to keep having this done. They're called Miralax. It's actually fairly easy and tolerable for a lot of people. There are other options out there. So again, if one thing doesn't work for you, don't just torture yourself that this is what it has to be every time. I usually recommend that people refrigerate it. If you don't like the drink that's recommended to take with it, which we would say Gatorade, mix it with something that you like, as long as it's not red. Maybe put it in a different glass, put it into a cocktail glass, make it feel different than just I'm sitting down with a big plastic jug to do this and it's torture. And make sure it's mixed well. Get a straw. Straws help to get it over your taste bud, and just sip it slowly. Put on the TV. Don't look at the jug until it's gone. Just look at the TV, be distracted. If you start to feel nauseous, just slow down. It's okay. Just take a break and then get back to it. But ultimately, getting a good prep is good. Talk to us, nurses or your physician, if it's not working for you, and we'll find another type of prep. But again, it's something we have to sometimes play around with, and we're happy to work with you on that, because we don't want to torture you. You have to get this done. So let's make it, be as okay as we can.
Thanks. And Jeannine, let's add in, so Anna's comment about like that she was so sore afterwards, and she now has a fear of having to go for more colonoscopies or procedures. So what do you recommend for someone who's like had a bad experience or that had a lot of pain either during it or after the procedure?
So this is not uncommon with people with inflammatory bowel disease. There's many reasons why it can be uncomfortable. It can be perianal disease. It can be just because you're inflamed. When you're inflamed, everything is sensitive. Air going in there is sensitive. And for a lot of people, you sometimes might have an experience where you're uncomfortable. You may have had surgeries and you might have a scar tissue there that makes it more challenging and difficult. So we don't always know this until maybe you've had your first colonoscopy. And again, just like the prep, you have to have this done. If you have a bad experience, talk to us. If you have discomfort, perianal discomfort, if you know that you're sensitive to things, we can always do our procedures with condensation and fentanyl. It's given through an IV, but a lot of people think they're completely out. And for a lot of people, that is completely appropriate. But we can also do something called propofol, which also goes through the IV. It is given by either an anesthesiologist or a nurse anesthetist, but we can get you a little bit deeper. And I highly recommend that for people who have had a tough time or a bad experience. And don't wait until the day of the procedure to tell us this. We do need to schedule it differently ahead of time. It's something that's good to talk to either with us, the nurse, or with your physician about your experience so we can make it better. And ultimately then you won't be scared to come back. And it makes me sad when I hear that people feel that way, because we want you to have a positive experience. After the procedure, most people don't feel much discomfort, but people who have had a lot of inflammation or a lot of scar tissue have told us, and I hear this all the time, that it takes them a few days to recover and sometimes even longer. So it is normal, but if you are experiencing severe pain afterwards, please contact your doctor. Don't presume it's normal. The lining can perforate, and having any disease puts you a little bit more at risk of having a perforation. So even though you may have some discomfort, do reach out for a little medical guidance if you're uncomfortable afterwards.
Great, thank you. Jeannine, can you just say what because at least it's a little crackly on my end. Can you just say what was the alternative drug that someone could get if they had like a bad experience before?
It's called propofol, and it's given by an anesthesiologist or a nurse anesthetist. It's still given through the IV, and we sometimes give it in combination with Versed and fentanyl.
Oh, okay, great, great. And actually, Leonora has just asked my next question that I was going to ask. So Leonora says, here, I'll bring it up here. My GI doctor just gave me a bowel prep. It's a gallon to drink. Then I have to do a liquid diet for a few days. With an ileostomy, should you do a bowel prep?
So again, if your doctor has advised you to do it, again, without knowing your history, I would follow your doctor's advice. However, with an ileostomy, a lot of what comes out is liquid. However, that liquid has the color of a lot of what you've eaten and some consistency. So depending on what they're looking for, if they want to see things clearly, you are going to have to have a bowel prep. Sometimes we would limit it depending on how much of the colon or small intestine has been moved. So again, I'd have to defer back to your doctors on that. It's a good question. We do sometimes, adjust it slightly if we have to. So good question to ask your doctor. It will depend on the frequency of what your output is and consistency of your output.
Are there any other suggestions that you have? We've already covered an awful lot, but are there any other suggestions that you have in order to make this experience a a little bit more comfortable or less dreaded, shall we say, so that people will do their follow-up, because it is really important to do your follow-up.
I think having a good relationship with your doctor, your team, your nurse practitioner, making sure that you are in with a group of people that make you feel comfortable and that looking out for you. And I think that again, if you ask questions and you feel that your doctor is not responding to them in an appropriate way, never be afraid to ask for another opinion. It's okay. So we expect that sometimes even amongst our colleagues, and Elaine knows this too, we're a teaching hospital. We will talk to each other and say, and the doctors will talk to each other, present cases. And I always say, to me, I respect anybody who will look to other people for opinions, even when they are, to me, they're already experts and they have a problem turning around to their peers and saying, you know what, I've tried everything with patient and it's just not working quite well. I really need some input. That, to me, when I recommend certain doctors, I recommend them because I see that, and I see that we're never done learning. I'm always saying to the kids, we're always learning. If I say I know it all, there's something wrong. Every day we learn something. So I think that, to me, that's something that's important, is just to keep that in mind.
Yes, great. Well, thank you so much, my darling sister Jeannine. I think we've covered a ton. And I just want to say thank you so much for being such a terrific nurse, and all of the nurses. Thank you for everything that you do. I've had so many amazing nurses, most of them friends of Jeannine's, and the doctors. I've also had amazing doctors. Thankfully, I only see them to say hi to now. I never have to go and see them. And in fact, next week, I'm going to have one of my GI doctors who I've thankfully haven't seen for any medical reasons now for years, but she's going to be coming on the show next week to talk about women's health issues. So we'll be talking about pregnancy, fertility, just women's issues with IBD, with Crohn's and colitis next week. So make sure you tune in for that. Jeannine, I'm going to let you go and I'm going to wrap things up here, but thank you so much for joining me today, and I will talk to you later, my darling. Thank you. And again, please keep posting up questions because we will be able to answer them. Thanks, love. I'll talk to you later. So everyone, thank you for all your great questions. Just as a reminder, you can go to my website. It's been TikToking across there at the bottom. It's elaineo'rourke.com. You can grab my free guide for people with ostomies, 3 ways to eliminate fears about your ostomy. And I also, there's just like great information there. And for people with Crohn's and colitis, you can go to the IBD programs page and you can sign up and get the 5 mistakes even well-informed people with IBD make. If you are struggling, as I said, if you are not thriving in your life, then get in touch with me. I really love working with people. I work with people one-on-one and also through my programs. And I'm going to be starting, nearly forgot to say it, I'm going to be starting a yoga series next week once I have enough people. Especially, it is designed for people with ostomies, with Crohn's, with colitis, with IBS. And that's going to be a 6-week series. It's through Zoom. You sign up. It is a paid-for service. But all of that information is on my website. Just go to the front page and you'll be brought there. If you do want to sign up for it, then please contact me sooner rather than later. And then what else? Yeah, follow me on YouTube if you can. Give me a subscribe, give me a thumbs up. Just let the videos all roll. That's really helpful. And also I'm on Instagram, Elaine O'Rourke Yoga. And next week, as I said, I'm going to have Dr. Sonia Friedman on the show with me. And that's going to be really informative, especially for us women to get some valuable information. She's been in this field for years and a great resource. So I'm just going to go back and check on the comments if there's any last comments Francine says, thank you, Jeannine. Yes, thank you, Jeannine. And Cheryl, thank you for tuning in also. And yeah, I guess that's a wrap again for this week. Thank you for joining me for this episode. And I will see you next Tuesday, live at 5 East Coast USA time. And in the meantime, please take care of yourselves and get outside if you can and enjoy some fresh air. All right. Night, night.